My name is Daniel Bracamontes. Today I'll be talking about schizotypal personality disorder, or in other words, SPD. So let's get right into it. Um, so off the bat here, I have a video of just a 1 minute video of explaining what exactly SPD is. So go ahead and play that.
I'm Dr. Ben Michaelis, and this is 1 Minute Diagnosis. Today I will be talking about schizotypal personality disorder. A person with
Schizotypal personality disorder has difficulty creating close relationships with others, acts in strange and unusual ways, such as 5 of the following 9 ways.
They believe that all comments or situations are about them. They believe they have psychic powers or magic powers, like they can see the future or control other people with their mind. They may have unusual experiences or feelings in their body which can't be explained. They communicate in confusing, repetitive, or nonsensical ways. They're suspicious of other people. They express few emotions, or the ones they do express, they express inappropriately, like laughing at a funeral. They dress or behave in odd or eccentric ways. They do not have close relationships outside of their family. They become anxious in public because they are afraid they will be hurt or threatened by other people. And that's schizotypal personality disorder in a minute. For other diagnoses, please visit drbenmichaelis.com.
So the main causes of this disorder, so there's not really what exactly goes wrong for a person with this disorder isn't known for certain, but it's likely that changes in the way the brain functions, genetics, environmental influences, and learned behaviors may play a role into developing this disorder. Um, some symptoms that a person may go through with this disorder is lacking close friends outside of the immediate family, so not really connecting with relationships as much, and they usually have flat emotions or limited or inappropriate emotional responses. Um, and they also go through social anxiety and incorrect interpretation of events, such as a feeling that something that is actually harmless or inoffensive has a direct personal meaning. Um, Another symptom is peculiar, eccentric, or unusual thinking, beliefs, or mannerisms, suspicious or paranoid thoughts, and constant doubts about the loyalty of others. That kind of ties into the role of social anxiety, and in which it's hard for them to socialize with just people in general, um, and also belief in special powers such as mental telepathy or superstitions, and last but not least, unusual perceptions such as sensing an absent person's presence or having illusions. Um, so the complications that come with this disorder, um, the person may go through depression and anxiety, specifically social anxiety, like we talked about in the last slide. And with this disorder, this may develop into a bigger disorder, which is schizophrenia. And not to be confused with these two disorders, but schizophrenia is more of a psychotic disorder, and schizotypal personality disorder, of course, is a personality disorder. Um, Also, the complications that come along with SPD is temporary psychotic episodes, usually in response to stress. They also have problems with alcohol or drugs, suicide attempts, and complications in the workplace or school, or just relationships with people in general. So, um, going on with that, relation to schizophrenia, they are kind of similar, but they're very different. Like I said, schizophrenia is more of a psychotic disorder, and schizotypal disorder is more of a personality disorder. if you look at that first bar there under schizophrenia, it says experience hallucinations and delusions, and that explains why that schizophrenia is a psychotic disorder. And but the disorder on the right, the schizoid personality disorder, is very similar to the schizotypal personality disorder, but yet there's still a little difference in there. If you look at the second bar under the schizoid personality disorder, it says voluntary social isolation, indifferent to other people. Um, Whereas in the schizotypal personality disorder, they have difficulty communicating with, just people, and they get that social anxiety. Um, but with schizoid personality disorder, they voluntarily isolate themselves from society and people, and that is kind of the difference between those two there. And some misconceptions of SPD is that it's a rare condition, and when in fact it's actually one of the personality disorders that has the most occurrence in the United States, with its prevalence rate being at 4%. And it's a higher among men, with the prevalence rate of 4.2 versus women who have a 3.7% prevalence rate. Um, Another misconception is that SPD resembles schizophrenia. Like we said, schizophrenia is more of a psychotic disorder, and SPD is a personality disorder. So kind of that kind of explains that. So, and also SPD is common in older adults. That actually is false, because 55% of people show symptoms of SPD before the age of 20. Um, and the prevalence rate for people 65 years and 74 years is much less than those that are young adults. For example, men between the ages of 65 and 74 have a prevalence rate of 1.89%, and women 65 to 74 years old have a prevalence rate of 1.25%. Another misconception is that SPD isn't treatable, and that brings me to my next slide, which is treatment. Um, so that misconception is obviously a misconception, because there is treatment, and there's not really medications for this disorder, but doctors or specialists give out medications for maybe their anxiety. So they give out anti-anxiety medication and depression medication as well. But the best treatment to have with this disorder is having psychotherapy. And there are three types of therapy that can help with this disorder. One of them being the cognitive behavioral therapy, which is identifying and challenging negative thought patterns, learning specific social skills, and modifying problem behaviors. Another therapy could be a supportive therapy, offering encouragement and fostering adaptive skills. And the last therapy is a family therapy, involving family members, which may help improve communication, trust, and the ability to work together in the home. So yeah, these are my sources. I hope you guys enjoyed this video and learned a little bit of schizotypal personality disorder. And I hope you guys have a good rest of the week. And yeah, thank you.